Welcome to another edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. Health programs in our community. Our guest today, ladies and gentlemen, first, Miss Danielle Hanson. She is Cape Fear Valley Health's Child Life Specialist. Also, we have today Miss Fran DeShazo, and she is the Director of Community Alternative Program and Development Coordinator of Community Engagements. So she wears double hats. Also, we have with us today, and she is not a newbie here, Miss Ashley Lee with Cape Fear Valley Health Foundation. Ladies, welcome to the broadcast.
Thank you so much.
Thank you.
First, Ashley, we're going to go to you.
Okay.
The Step Up for Health and Wellness Expo. Give us a little refresher, give us a little history about it.
Yes, so our Step Up for Health and Wellness event is a one-off from our ribbon walk we used to have many, many years ago, and for a long time, mainly for cancer. And so Step Up for Health is now a new branch that we've done for the last 3 years. This one is at Methodist University, April 12th. The history is we try and bring in all service lines that would like to participate in the event. So we have cancer, CAP, CCMAP, pediatrics, heart, and nursing education scholarship. So it's just a fun time for all of our staff, community, everybody to get together over at Methodist University. We do a walk and just celebrate healthcare, also by raising funds to help enhance the resources at the hospital and different service lines.
All right, now you've told us about the different groups and organizations that will be there. So a person attending the event, what can they expect? Give me some atmosphere.
So when you get there, it's kind of, most people are registering still or grabbing their t-shirts who have already registered, checking in, and then we start off with a really moving opening ceremony. We do a lifelink flyover. We do some stretches. Our Health Flex comes and we do a fun Zumba lesson just to get our blood pumping, and then we do a really rewarding survivor walk. It's not really a lap, but any survivor we welcome now. Evidently cancer, obviously, but also stroke, cardiac, any survivor in the healthcare department basically can come and do a lap. We do a walk, and they actually get together. We hug. It's very moving, and they lead the lap, so they come to the front of the line. And then we start with all of our survivors. We do the walk, and that's through the campus of Methodist University. It's a 4K or a 1 mile, and some people you don't really even have to walk. They're there just for the atmosphere and the support. Once the walk is over with, then we do the Wellness Expo part. We have dance parties, we have a kids zone, wellness expos from our community organizations as well as our hospital system organization. So it's just a really fun time to come together, promote healthcare, promote resources in our community that most people might not know about or could learn about, and then it's just a great time.
Danielle, let's go to you. Let's talk about who this event benefits. How is Step Up for Health benefited? Ashley mentioned the pediatrics. How has Step Up for Health benefited pediatric patients at Cape Fear Valley Health and in other parts of the health system?
Absolutely. So our Women's and Children department covers pediatrics,
pediatric ICU, NICU, our pediatric ED. That includes our purple zone and yellow zone. Also our behavioral health unit for our teenagers. We also have L&D and FCCU. So there are many different departments for this Step Up for Health event to benefit, specifically for pediatrics in pediatric ICU, because that is where I am. This is something that's great for any playroom activities. Right now is respiratory season, so we have a lot of cold, flu, coronavirus is still there, RSV, rhinovirus. So all of those need some respiratory incentives. So that includes bubbles and pinwheels, things that are little but also benefit greatly. So things like that, also Play-Doh for some sensory play and also for a little bit of distraction. So whenever there's any pokes or anything that's considered like a negative stimuli, having something to hold like a Play-Doh, stress balls, something to give them something else to focus on can really support that. The pediatric ICU is a 7-bed unit where the pediatric unit is 19 beds. So we have plenty of patients that we see day in, day out that could really benefit from the monetary donations that we get from Step Up for Health.
Danielle, what, from a personal point of view, what is so special about Cape Fear Valley Health's pediatric services?
You know, I was thinking about this the other day, and I think it really comes down to we are a teaching service. We love to teach and we love to learn. We have anywhere from new grads to college nursing students to residents to shadowing interns that all participate in rounds. So they give us different ideas. They ask great questions. We elaborate. One of the biggest things for a child life specialist is to provide knowledge and education for the patient. So I always carry around a little IV catheter on my badge so that at any point in time I need to talk about it, I can let the children know that there is no needle in their arm. A lot of misconceptions come from not understanding the hospital environment, so being able to explain those and being able to teach on a dime's notice is really beneficial. The pediatric ICU, something that is really near and dear to my heart, is our bereavement services. That's the kind of sad part of the job, but we do see children and older teens that have deaths on the unit, and we provide bereavement services. So that looks like having a beautiful bereavement box that has pressed flowers in it, that has inkless prints that we can offer, also resin molds and locks of hair. So all of these things that make the pediatric unit very special to me, but also come at a cost too. So it is such a beneficial way to really make sure that the unit is covered through Step Up for Health.
Ladies and gentlemen, we're discussing Step Up for Health and Wellness Expo, which takes place next month, April 12th at Methodist University. And our in-studio guest, Ms. Danielle Hansen. She is Cape Fear Valley Health's Child Life Specialist. We also have Ms. Fran DeShazo. We'll say it again.
Good job.
Good job. Okay. And we're going to hear from her in just a bit. And we have Miss Ashley Lee. She is with Cape Fear Valley Health Foundation. Fran, let's bring you into the conversation. What is the Community Alternatives Program, and what does it do, and how has this program benefited from the Step Up for Health? That's a 3-part question.
Right, right. A lot of people don't know about our program because it's a little bit different than the other service lines. We are a program that allows our most medically fragile patients to be able to stay in their homes instead of going to skilled nursing facilities. So our job, and we cover 4 counties, we cover Harnett, not Sampson, we cover Harnett. Anywhere that there's a Cape Fear Valley hospital, we cover that county. So Hoke, Harnett, Bladen, and Cumberland. And our job is to ensure that they are able to stay in their home safely, have their needs met in every way. And we take individuals over the age of 18. It is a Medicaid program, which means that you have to qualify for long-term Medicaid as you would for a skilled nursing facility. So it's two-part. You qualify for Medicaid, and then you qualify medically for a skilled level of care. And we provide services that Medicaid usually doesn't provide. But even with those extra services, we have utilized the foundation in various different ways for our patients. We have asked the foundation to purchase little refrigerators for medications. We have asked them to help our patients stay in their homes because they're so medically complicated for them to have to move for whatever situation. And most of them, actually all of them, are on some type of SSI or Social Security, so their incomes are so incredibly limited that every dollar counts. And the foundation has purchased all kinds of specialized medical equipment for our patients, things that Medicare and Medicaid don't cover, that allow them to, most of our patients are also bedbound, so they've purchased specialized mattresses, tables, equipment for bathrooms, and one of the things that they've been so great about is they've actually never said no to anything that we've requested.
Awesome.
But we try and be careful about what we ask for. And just last week, we had a bedbound patient that needed to be seen at Chapel Hill right away for lesions in her throat. They were afraid that it was going to be cancer. And we could not find transportation for her until next month or the month after. And the foundation agreed to pay for her transportation, and it was a completely life-changing visit for her. So we love the foundation in our program, in our department. We're very, very grateful for everything that they do for our patients.
Fran, you mentioned people on Medicaid that they use the service. And you basically mentioned a few of the requirements, but are there any other requirements that they have to have in order to use the services?
Well, with Medicaid, when you hear Medicaid, you think one program.
Yeah.
There are multiple programs under Medicaid. So you may qualify for long-term Medicaid services for our program, but you may not qualify for another Medicaid program. So if you have Medicaid, you still have to apply for CAP Medicaid or long-term Medicaid. And unfortunately, it needs to be full Medicaid. It can't be, some people qualify for a spin-down service, and that doesn't usually work. So it has to be full Medicaid in order to qualify. Medically, like I've said before, our patients are very medically fragile. Most of them are wheelchair bound. We have a large dementia, Alzheimer's population. In fact, Alzheimer's and dementia, that diagnosis actually gets you to the front of the line. Because as we know with Alzheimer's and dementia, they do better in environments that they're comfortable in. So we definitely want to try and keep them at home if we can.
Okay.
So,
Ladies and gentlemen, our topic today, Step Up for Health and Wellness Expo that takes place next month out at Methodist University. And our guest today, Danielle Hanson, Fran DeShazo, and Miss Ashley Lee. And Ashley, we're going to go back and talk to you now. What I've just heard are some great examples of how Step Up for Health has impacted the community and impacted lives in our area. Now, can you tell us about some of the other programs that this event supports?
Yes, Omega, thank you. So we have cancer for sure. We have cancer, we have heart, so they help with our community hands-only CPR education programs. We have our nursing education scholarship that helps with helping our nurses with lateral entries or moving up the clinical ladder, to say, for education. Also, we have our CC MAP, which is a bridge between a medication payment issue, I would say. CC MAP is when you are newly diagnosed with something, or you just don't have the means to pay for a medication that you need, and maybe you have to go through an application process through Medicaid, and they help in the meantime pick up that expense. So for whatever reason you may need your medication, they can go ahead and kick in until that insurance is fully covering your program. Cancer, we help with patients for many things: wig vouchers, gas vouchers, rent, mortgage expenses, education materials, so many things with cancer that we help with. And this event has raised, with the Ribbon Walk and Step Up for Health together, is over $1 million.
Really?
In cancer alone.
Wow.
Yes.
Now, Ashley, cancer survivors, I understand that that's one group that is usually recognized at Step Up for Health.
Yes.
Is that still happening?
Yes, ma'am. So we are doing a little different this year and last year. We are asking any survivors medically if they would like to come and be recognized. So, of course, our cancer survivors will be there, and they're ready, they're excited, looking forward to it, but also stroke, heart attack, any other survivors are also welcome to come and do the walk.
Is this strictly, you did mention that the family members and that type of thing, they can come. It doesn't necessarily have to be the survivor. Can the family members also attend?
Yes, we want everybody to attend. So you just have to register, and that's at cfvfoundation.org. And we have an early bird rate that ends this weekend. So the price goes up after this weekend, but anybody can come and attend. We have kid zones for the small families, and just a lot, any age. We'd love to have you.
Ladies and gentlemen, we're talking about the Step Up for Health and Wellness Expo today on Cape Fear Valley Health's Making Rounds Live. If you would like to be part of the conversation, what you can do is you can give us a call at 910-483-6111. Ms. Glenda's at the front. She'll take that message. She'll take the question and bring it on back to the back, and we can get it answered for you. Also, Lindsay, she's working hard as always, and you can drop the question in the comment box if you're following us on the live feed, and if Lindsay can probably answer the question herself, but if she can't, she'll make sure that she gets it to us so we can get those questions answered. Finally, I want you to share the broadcast. The reason why Step Up for Health and Wellness Expo is a big event in this area, a lot of information we're covering today, and you don't want to be that middleman because you're always going to miss something. So if you share the broadcast, you can avoid being the middleman and just go watch it for yourself. Today on Making Rounds Live, we're discussing Step Up for Health and Wellness Expo with Danielle Hanson, Fran DeShazo, and Miss Ashley Lee. Now, Fran, we're going to go talk to you. Are you going to be at this year's event?
Yes.
All right. Have you been in the past?
I've been to almost every event, yes.
And what have your experiences been like?
Well, I have always represented CAP at the Step Up for Health. We have a booth, but as an individual, it is so fun. There are food trucks, there are all kinds of freebies from all of the vendors that participate.
You said freebies.
Yes. We have freebies at our table too. And the music is amazing. It's so fun. I love it. My team usually comes out, and I love to see them having fun out doing line dances. It's awesome. And as a cancer survivor, it is incredibly emotional and uplifting to be able to participate in the cancer walk. And this year, having others join us being survivors is just a wonderful, phenomenal thing.
It's going to be a tearjerker. That's what
I'm
it's
getting
going
emotional
to
just
be.
thinking about it. It's going to be amazing.
Ashley, let's bring you back into the picture. Can people choose to support, or do people have to choose one specific organization when they register, or can they spread their love around?
No, Omega, they do not have to change. They don't have to choose. They can do all in, and that supports all of the service lines. Or if there is a service line that they work at or is near and dear to their heart, they can actually choose that service line, and all of their registration fee can go just to that service line.
Let's talk about participants, Ashley. Are most of the participants walking and running, are they doing it by themselves, or most of them involved with teams? I did hear teams mentioned earlier by Fran.
So the teams, you can create a team. So like you can create a team where you work, or a team that's important to you, or you can just sign up for that service line. But as far as the walk-in, if someone wanted to come by themselves, they would be completely welcome. We would love to have them. We don't meet strangers, so everybody's welcome. We love it. The more the merrier. The more people, the more resources that you are helping provide to your community. So you don't have to have a team, but you're welcome to create a team and help boost it in a way, boost the event that way.
All right, for someone that wants to be part of the team, is there any more information that they need? Are there any other options that they need to be aware of?
No, not really. It's just another way to support and sign up. We have departmental, I would say, healthy competitions. Not really competitions, but you can see how many people sign up for teams. So that's kind of fun. And then some of the teams are just to make light of the situation. It's just really funny. Some of them are fun.
All right. Ladies and gentlemen, we're talking about the Step Up for Health and Wellness Expo. Mark the date. April 12th, Methodist University is where it will be. And that's what we're talking about today on Cape Fear Valley Health's Making Rounds Live. And Ashley, co-workers are competitive. They are very competitive. Just talk to radio people. Now, if someone is interested in starting a team, what would they do? How would they find a team to join? Talk to me.
Yeah, so they are more than welcome. They could start their own team right now. Matter of fact, I started a team last year as it being my first year. You just go onto the website at cfvfoundation.org, and you can see the Click to Register Step Up for Health event. And as you go to register, there's an option to create a team through the registration process. My team was Step It Up Buttercup. Step It Up Buttercup. We have chaos coordinators, different ways. But no, it's very user-friendly to create a team, and anybody can create a team. Some businesses do it just to show that they're supporting through walking without sponsoring. Just so many different reasons to create a team, but don't let that make you alarmed if you don't have a team or don't have anybody or know anybody in a team. You can join a team or just join without a team. There's no big deal either way.
Ladies and gentlemen, we're in the middle of talking about Step Up for Health and Wellness Expo. April 12th, Methodist University. Make sure you put it on your calendar. Our in-studio guests, Ms. Danielle Hanson, Ms. Fran DeShazo, and Ms. Ashley Lee. When we return, we're going to continue talking about the Step Up for Health and Wellness Health and Wellness Expo and how it benefits the community. Cape Fear Valley Health's Making Rounds Live. Make sure you stay close.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The WIDU Radio Network.
This is Pastor Neil of New Covenant Christian Faith Church Ministry, and you are listening to Wake Up.
This is Pastor Steve and Sandra McMillan of the New Life Covenant Fellowship, 362 Neville Street, Fayetteville, North Carolina. We are excited to be a sponsor of the Wake Up.
I'm Pastor Jerry D. Swinney from Bethel Christian Assembly at 1065 Progress Street here in the city of Fayetteville, North Carolina. And you're listening to Wake Up.
1 year after mobile sports betting launched in North Carolina, the industry has generated more than double the tax revenue initially projected by lawmakers. After yesterday's triple-digit drops across all three major markets, traders are bracing for the possibility of another volatile day. This has worries built over tariffs as President Trump did not rule out the possibility of entering a recession in an interview over the weekend. North Carolina lawmakers are advancing legislation that would require gun owners to report stolen firearms within 48 hours or face potential fines. Greenland's elections are underway, with some seeing it as a chance to free the country from Danish rule. All six main parties support independence, although they have different views on how and when it could be achieved. And Duke Energy is planning a small modular nuclear reactor at Blues Creek in Stokes County. Mike Rayleigh, NCN News.
I'm Peter Killeen, WIDU Radio News. Yesterday morning about 8 a.m., officers with Fayetteville Police went to the report of a shooting, the 1300 block of Sapona Road. Upon arrival, officers located an adult male with gunshot wounds. The victim pronounced dead at the scene. He's been identified as 51-year-old Darden Rhodes of Missouri. A man shot dead in Fayetteville Saturday night. Happened about 10 p.m. The 300 block of Pebble Street. Deputies responded to a shots fired call. They found an unresponsive man with a gunshot wound. He was pronounced dead at the scene. The victim's name being withheld until next of kin are notified. Cumberland County Board of Commissioners will host a joint city and county liaison committee meeting with members of the City of Fayetteville Government City Council coming up next Monday, 12 p.m. The meeting will focus on bringing the city and county together to improve quality of life for citizens. Media and community members encouraged to attend. From WIDU Radio, I'm Peter Killeen.
It's a chilly start here to our Tuesday morning, a little breezy at times with a storm system moving off the East Coast. Mostly sunny as we head into the afternoon and high temperatures ranging between the low to mid 70s. Overnight, we're in the low to mid 40s. Then Wednesday,